good afternoon, everyone, and thank you, Marge, for that kind introduction. As was mentioned, my name is Jason Coe. I'm a faculty member at the Ontario Veterinary College, which is 1 hour drive northwest of where we are. So I wanted to take this opportunity just to extend a warm Canadian welcome to those that are joining us virtually, as well as those that are here. I'm really excited to have this opportunity to be here with you today to share some of the work that we've been doing at the Ontario Veterinary College that I think highlights the role communication can have in improving obesity prevention and management. And so I just wanted to take a moment to acknowledge some of the relationships, financial relationships that I've had the opportunity to have over the last few years. I'll point out a few because I'm going to be talking about nutrition and obesity. So Nestle Purina, Royal Canin, Hills, and obviously the Purina Institute for having me here. And I appreciate the invitation to be here with you this afternoon. In terms of where I see us going over the 50 minutes that we have together, I'm going to highlight some objectives, the things that I hope you walk away with at the end of my session with. Then we're going to talk about communication in veterinary practice at a very high level before we start focusing in on some of the research we've been doing that helps inform some building blocks I believe we can use to create a weight management recommendation that leads to client investment and ultimately commitment. And then my hope is at the end to end by taking those building blocks and applying them to a case scenario. So in terms of the things that I hope you walk away with by the end of our time together this afternoon, first off is a greater awareness for the direct role communication has in improving the outcomes of obesity prevention and management. The second thing that I hope you walk away with is an increased sort of attention to your own conversations with clients if you're in a clinical practice, and the impacts that that communication has with your clients on the outcomes of obesity prevention and management, as well as being able to pay attention to others in their conversations and really learn from some of the evidence that we're starting to develop in this area. Another thing that I hope you walk away is an appreciation for 5 stages of change that people go through when they're adapting behaviors. And I think it's a framework that we can utilize and appreciate in terms of pet owners going through when they're making changes in relation to their behaviors that relate to pet obesity, whether from a prevention or a management standpoint. And then finally, my hope is to give you some building blocks that can be used in practice that lead to a weight management recommendation that has greater client investment and ultimately commitment. So I talked about talking very generally. So for those of you that are clinicians, this is you in your clinician role. So if you have a client-facing role, this is the first poll. You can see the Slido QR is there if you haven't got into it. But I'm curious, for those that are clinicians, what are the important outcomes for you in veterinary practice today? So when you get up in the morning, when you put your clothes on and go into work, what are you trying to achieve for yourself, for your teams, and ultimately for the clients and the patients in your care? For those of you that aren't clinicians, what I'd like you to do is either put yourself in the role of a clinician or think about it from the client perspective. What are the things that you would be looking for to get out of the interactions that happen in veterinary practice every day? So we're going to wait a moment here and see some of the thoughts that come up. You can enter these in with single words. You can obviously enter phrases. So we'll just give a moment for some of these things to show up onto the screen. So I see a lot of patient happiness, healthy patients coming up here. I saw adherence, I see client satisfaction, having fun, probably for you, your team, hopefully the clients and patients as well. And so we recognize there are a lot of important outcomes as it relates to veterinary medicine and what we're trying to achieve in veterinary practice every day. Well, what I can tell you based on 40 years of research in human medicine looking at physician-patient communication and almost 20 years now of research looking at veterinary client communication is that through effective interactions in practice, we can impact pretty much most, if not all, of those outcomes that you've told me are important in veterinary practice every day. That research shows that depending on how we gather information, so starting with inviting questions that really allow clients to share their story, moving in with more focused yet targeted questions that allow them to explain further details on areas, and reserving those, what we call a closed-ended question, a question that's often answered with a single word response. The ones we're all taught, such as any vomiting, any diarrhea, any coughing, sneezing, if we save those till the end, it's been shown we can gather a much more accurate picture of what's going on in a more efficient manner. It's also been shown that we can impact client recall and understanding, their ability to understand the information that we have to share with them. And as we think about pet obesity, oftentimes it's not just the client in the examination room that we need to work with, but we need to be working with the entire family unit. And so we can increase the recall, their ability to take that information back and share it with other members of the family. It impacts on satisfaction, and not just client satisfaction. I saw someone say they wanted to have fun. It impacts on our satisfaction too as veterinary professionals in terms of the outcomes of the interactions that we have. It can influence adherence, and I'll share a little bit of work we've done on that in veterinary practice. Reduce malpractice complaints. Imagine there isn't a veterinarian that looks forward to getting a registered letter from their licensing body, and so we know 70 to 80% of those, at the core of them, is some form of communication breakdown, and so we can ward those off. And then patient health. Why probably, regardless of what your role is in veterinary medicine, most, if not all of us, we're really focused on is improving the lives of the animals and the work we do every day. So at the end of the day, communication really forms the bridge in taking the amazing knowledge that's been gained by the researchers that do the research that's being presented here today, and actually getting that into the hands of the client, which then helps it reach the pets that benefit from that research. And so without a strong bridge, we have a gap in terms of being able to take that knowledge and get it to the clients and patients that are in our care at the foundation of delivering veterinary medicine. And so when we look at the research in human medicine and veterinary medicine related to communication, and we look at it at a very high level, we can really break the communication down between a veterinarian and client into two general patterns. The first is what's being called a veterinarian-centered approach. And it's been equated to being like a shot put. So we take the great knowledge that we've gained over the years on how to prevent and manage pet obesity. We develop it into a really well-conceived message. We take that message, we send it up into the air, and we let it slam down onto our client, just like a shot put would. And so the focus of this is making sure we've got the right message, and we deliver that message to our client. The second general approach has been described as a relationship-centered approach. And it's much more like a frisbee toss, where if I toss you a frisbee, you're likely to toss me a frisbee back. And so it recognizes that within any interaction, there's at least two individuals involved, and it's through a process of sharing information that we start to develop better understanding of each other's perspective. Through that understanding, we can start to identify common ground, which sets us up for working together to find a plan or a recommendation that leads to greater investment and commitment. So we've done a few studies now in veterinary medicine where we've gone out, put cameras in the corner of the examination room, and recorded the interactions between veterinarians and clients. And in one study, immediately following those interactions, we gave clients a validated client satisfaction measure. And what we found was when we analyzed the interactions that were recorded, those interactions that took on a more relationship-centered approach, clients were significantly more satisfied at the end of those visits. We've also looked at it in the context of client adherence. And so again, video cameras in the corner of the examination room. We picked out the interactions where the veterinarian made a recommendation for a dental or surgical procedure for the patient involved in those interactions. We then followed that for 6 months to see whether or not the client ever followed through with that recommendation for the dental or surgical procedure. What we found when we went back to the original interactions where the recommendation was made, those interactions that led to the client following through, adhering with the recommendation, scored significantly higher for a relationship-centered approach. And so I share this general research as it relates to the role of communication in veterinary practice with you today to highlight that how clinicians, how veterinary professionals engage with clients impacts the important outcomes you've told me are important to people in the veterinary profession working on the front line every day. And so how we engage and interact with clients around their pet's weight, particularly as it relates to preventing and managing pet obesity, is going to have an important impact on important outcomes in veterinary care. So when we think about communication, we really need to think about it in the context of three elements that make up a communication. The first is the content. It's the what we say. It's the great knowledge that gets developed through research, and we develop this research base in a specific area. And we know that there's been a lot of research to inform how we manage and how we prevent pet obesity. The second is the perceptual aspects of communication. It's so what we think and feel about a topic or an area of veterinary medicine. Also, though, how a client thinks and feels about a topic related to veterinary medicine. The third element of any communication is the process. That's how we communicate it, and that's what I largely focus on, is the process in terms of communication. So we have great content knowledge, we have great process in terms of the research we're developing in this area, yet oftentimes we forget about the perceptual aspects of communication. The how we as a practitioner think, feel towards a client. We just published some work suggesting that there may be an implicit weight bias for many veterinary professionals that needs to be taken into consideration, as well as our judgments or assumptions that we might have as towards a client. We also, though, need to think about it from the perspective of a client and how they think and feel about a topic, because how we think and feel oftentimes influences what we do related to that topic. Which brings me to the 5 stages of change. And so these, again, are 5 stages of change that are recognized in moving towards any type of behavior change that an individual might go through. And I think it works very well in relation to pet obesity. So we start with pre-contemplation. This is before you even realize that there might be a problem that exists, or you're a bit of I would say, in denial that there's a problem that exists. Then we move into contemplation. So now you recognize there's a problem, yet there's all these reasons why you can't necessarily address these problems. And so there's a fair bit of pushback or ambivalence. Once we move past that, we move into preparation. So we recognize there's a problem, we want to do something, but we really haven't gotten to the point of doing something, which is followed by action. So now we're actually doing something or trying something to address it. And then finally, maintenance. You just kind of stick with it and keep applying it. And a person can move through from one stage to the next, yet often they can relapse back to a previous stage. Also for a behavior change, lots of times you go through all 5 stages several times before you actually get to a point where you're changing behavior. And so we've just published, and it came out a couple of weeks ago, a study that Dr. Kat Sutherland did alongside with me while she was doing her PhD, where we looked at the stages of change related to pet obesity for some pet owners. So we had a survey, we did it by survey because of the pandemic, that we sent out, and we had over 500 pet owners respond. We had, as part of that survey, them self-identify the body condition score of their pet, of which just over 150 identified it as a 6 or greater, so to be overweight, of which 119 did our stages of change measure or scale. And what we found was 52% of those people that self-identified their pet as being overweight were in a pre-contemplation phase of change. 42% were in that contemplation phase of change related to their pets being overweight. So 92% were in pre-contemplation or contemplation. 6% were in preparation, action, or maintenance. Now, why does this matter? Because each of these different stages of change requires a different approach in terms of how we communicate with those owners. So pre-contemplation and contemplation, we want to evoke motivation. So if we think back to my shot put versus frisbee, shot put probably is not going to be tremendously successful in evoking motivation. When we move to preparation, these people are ready to move to that next stage, but they need our assistance in developing that plan. And then those that are in action and maintenance, it really is about ongoing support. How do we support them in their efforts to address their pet's weight? Which leads us into the building blocks of creating a weight management recommendation. How do we evoke motivation? How do we help plan with a client? How do we support a client? And so we've been doing research for the last 15 years that really helps inform a lot of the pieces that can go into a recommendation. And so the last little while, we've been doing a fair bit of research specific to nutrition. And the reason being, the American Animal Hospital Association and the World Small Animal Veterinary Association identified nutrition as the 5th vital assessment, where a nutritional assessment and recommendation should be a part of every companion animal's visit to a veterinarian. That's not going to be surprising to the people in this room. So we focused our wanting to better understand, well, what are the conversations happening around nutrition, given it has such a critical role in veterinary practice? And so we have a study that involved 284 interactions. Within those 284 interactions, we identified 42 instances where the veterinarian made a proposal or recommendation for a long-term dietary change for the patient involved in those interactions. Sorry, I need to go back. 55%, we were surprised, met some kind of overt client resistance. The rest, the client either took them up or didn't give the veterinarian anything. And to be honest, those ones where they give you nothing, those are the most challenging. But we were intrigued by the 55% where there was some pushback on the recommendation. And so we wanted to dig in and see, well, what's the basis of clients' resistance to these recommendations that are being made? The number one thing was pet preference. So my pet really likes what it eats, it's picky, I'm hesitant to change. Or I've tried a food like that, it didn't like it, and so pet preference was number one. Number two were multi-pet households. Probably not a surprise to anyone that works with clients where 3 cats, 1 cat should be on something the other shouldn't. How am I ever gonna make this work? Number 3 were instances where the veterinarian used a health concern as a basis for making their recommendation, and the client pushed back on it, feeling that they were already trying to do something to address that. So a veterinarian's making a recommendation to switch over to a dental diet for dental health. The client says, well, I'm feeding dental treats a few times a week. Shouldn't that be enough? And the 4th most common was the pet was already on the food that the veterinarian was recommending. So when we looked at this, what we started to recognize is that these are all human, animal, or environment-related factors that we could gather through a more comprehensive history, take those into consideration, build them into our recommendation to reduce the chances of resistance. And it's important for us to recognize that resistance is a product of our interaction, and yet sometimes we think it's a characteristic of our client. And when we face resistance, what it means is that we probably have more work to do with the client to overcome that. And so I actually don't think resistance is a bad thing, because it gives us something to work with a client. And if we can actually gather more history ahead of time, we may be able to avoid that resistance altogether by incorporating that client's perspective into our recommendation. So we don't have to play catch up in terms of managing the resistance that we're facing in the exam room. So from my standpoint, the foundation of any recommendation, the foundation of weight management recommendation is a comprehensive history. And I can't overemphasize this, where we're gathering information about the animal, the environment, and the human. So I want you to imagine that regardless if you have a clinical role or not, you're in a veterinary practice, and I'm coming to see you with Joey, my kitten. And I'm curious, if you wanted to gather sort of nutritional information from me, what would be the very first nutrition-specific question you would ask me? So I'm asking you to put yourself in the role of a veterinary professional. You're coming in to talk to me about Joey, and I'm curious as to what is the very first nutrition-specific question you would ask me. So what does Fluffy like to eat? What diet are you currently feeding? What is the best diet to feed my new kitten? What is he eating? Some are asking some cursory questions to get at probably a better understanding, to see what life stage we need to be thinking about. Tell me about what Joey is currently eating. Tell me about what you're feeding your kitten. I love to see these tell me because about 5 to 7 years ago, I wouldn't have seen very many of those, so it's great to see some of the penetration. And so we're going to come back to this. But because we found that in response to those recommendations, there was a need potentially for greater information gathering around animal, environment, and human, we thought, well, let's look. Let's see how veterinarians are gathering information. Specifically, how are they gathering information around nutrition? So when we looked at the same data set, what we identified were 99 instances where a veterinarian used a question to initiate their nutrition conversation with the pet owner involved. And there was a predominant question form that was used. In 76% of those 99 instances, it was what we call a what-based or what-preface question. And we saw that come up when I asked some of you, what would be your very first question that you would ask me in relation to Joey? And so those what-based or what-preface questions, most predominantly the question that was used was, what kind of food does she eat? Now there were some variations in that. What kind of food are they on right now? What food are you feeding them? Sometimes they exchanged the word kind with the word type, but they predominantly started with the word what. So then we became curious, well, okay, if this is being predominantly used in veterinary practice, what is clients' response? How much information do they give around this? And so we found that 61% of the time in response to that what-based or what-preface question, clients gave one item that their pet was currently eating. And when they gave one item, it was predominantly brand-related information. So they might actually give a brand name or the color of the bag or where they acquire it from. But 61% of the time, they got one item, which was predominantly brand-related information. 28% of the time, they got up to 2 items that the pet was currently eating. So 89% of the time in response to that what-based or what-preface question, we pulled out 2 items that that pet was currently eating. What's intriguing to me was only 8% of the time were treats ever mentioned in response to that what-based or what-preface question. And I appreciate not all clients give their pets food beyond the main diet, yet I would say it's pretty widely accepted that many give food beyond the main diet, suggesting there's more information to be gained here. What was further interesting was in 75% of the cases we looked at, the veterinarian didn't ask about any other food other than what they got through that what-based or what-prefaced question, suggesting to me that they're getting fairly limited nutritional histories. And we know for many conditions in veterinary medicine, nutrition-related conditions, obesity being a prime example, we need to know every piece of food going into that animal's mouth so that we can account for those calories. And so when we really dug in, what we recognized is that what-based or what-preface question that was being used by many veterinarians was acting like a closed-ended question. It was getting a very limited response, predominantly related to brand. It wasn't encouraging that engagement that I talked about with the Frisbee toss. And interestingly, in a number of cases, we saw the client get somewhat defensive to that question. And as I've thought about it, it makes sense. Put myself in a client's shoes. I go into a veterinary practice. I'm in the waiting room. Oftentimes, what am I staring at? 1 or 2 brands of food. Go into the examination room, the technician or the veterinarian's having a conversation that transitions to nutrition, and the first question they ask is, what kind of food are you feeding? I'd be sitting there as a client thinking, well, it's not what I saw in the waiting room, so I'm gonna have to defend what I'm feeding. So the message is not to not have food in the waiting room. There's practice management support for that. It's not that we don't wanna know what brand of food they're feeding, yet we need to look at different ways to approach this conversation where we're not putting pet owners on the defensiveness. So following the publication of this, we thought, well, hey, let's run a study and let's go out and try some different questions and see how they work in terms of gathering information from clients. And so we sent a research assistant out into general practice. They were assigned to go in ahead of the veterinarian, and they randomly asked 1 of 3 different questions to see how clients responded to them. And so one of the questions we tested was that, what kind of food is he eating? And so what we found when we analyzed it was that question on average pulled out 1.3 items, always got information about main diet, yet rarely got information about treats and human food. So it's pretty consistent with what we saw in our observational study. And it took clients 15 seconds to respond. Another question we tested was this one, which we had proposed to the veterinary profession as an alternative to what kind of food is he eating. So tell me about everything Max eats throughout a day, starting first thing in the morning, right through to the end of the day. I like it because it asks for everything up front, It also provides some structure to help a client's recall from first thing in the morning right through to the end of the day. So we thought, let's test it and see what happens. And so when we did that, what we found is, with this question, we got 3.5 items on average in terms of what the pet was eating. Always still information about main diet, yet commonly got more information about treats and human food. Yet it did take 43.6 seconds for clients to respond, so 28.6 seconds longer. And yet my argument is, how many of those more focused, closed-ended questions do you need to ask at 15 seconds a pop to get that same amount of information you would get through that open-ended question? The other thing I'll throw out there is that at the end of the study, we had all clients fill out a diet history form. The only place there was a significant difference in what the diet history form got from the tell me question was treats. And I share that because it is an area that we do need to explore a little bit more directly with our clients. So tell me a little more about the things that Rory gets outside of his main diet so that we can really explore that, so that we can develop a weight management plan that's tailored to what is happening for that pet and client. More recently, we have a large data set of 917 interactions that we recorded and we've been looking at. 463 involve some mention of weight. And so we thought, well, let's look at how those nutritional histories are being gathered. Within those 463, 2.5% of the time was an open-ended question used, an inviting question to really allow the client to share their nutritional story. And so it highlights an opportunity, again, to create the foundation for our recommendations. So pop quiz. What kind of food does he eat? Is this an inviting, what we'd call an open-ended question? So that would be yes. Is it not an open-ended question, so more of a closed-ended question? That would be no. And then if you're unsure, we'll have you hit the third option. So we'll give it a moment here just for people to share their thoughts, but is what kind of food does he eat what we call an open, inviting question? Yes, no, unsure. It's kind of like a horse race, and I think the no is winning with 96%. And so great. I think I've made my point in relation to that, that our research supports that what kind of food does he eat acts as a closed-ended question that gets us very limited information. And so we want to use stems such as tell me to really make these invitations inviting and broad. So tell me everything he eats during the day, starting first thing in the morning right through to the end of the day. Or describe. Describe for me what's important to you when you're making food choices for Rory. Or walk me through. Walk me through a typical day for Rory, including all the food and exercise he would receive. Now, it's been said that we should avoid why questions. At first glance, it seems like a why question might be open-ended, and yet the reason behind avoiding a why question is when we ask somebody, why are you feeding your pet 6 times a day? It can put people on the defensive, and we really want to pay attention to how we frame our questions so we're not putting people on the defensive from the time we start these conversations. So again, I mentioned earlier, I can't overemphasize the role that a comprehensive history plays in the foundation of a recommendation. One that starts with those broad, inviting questions that then narrow down on specific areas such as treats or extra foods outside of the main diet, and then we end with the closed-ended questions, the ones that really zone in on the things that we haven't gathered from our client, which might be the kind of food that they're feeding, but we're not going to ask that as our first question. And we want to make sure that we're exploring the animal, the environment, and the human aspects. And this human one probably pays bigger. Our research suggests that veterinary professionals see pet obesity as a human-related issue. And so we need to make sure that we're exploring and understanding where that client's coming from, their perspective, what's important to them in terms of managing their pet's weight. Once we have that comprehensive history, it sets us up for transitioning the conversation. So we've also been looking at how veterinary professionals can use trends to support their conversation. So graphical illustration of trends related to a variety of different areas. And yet when we looked in practice, the area that's used most often for trending to support a conversation is weight. And I think it works quite well because if you illustrate over the last few years the trend, you can start picking things up before they get outside of a normal range, have a prevention conversation. It also is a great way of transitioning or facilitating a weight conversation. And so we use the transition to really test our client's readiness for moving into that conversation. It might sound something like, Jamie, I'd like to spend some time discussing max weight. Would you be open to that? Now, I can imagine some of you are there thinking, wait a minute, I would never ask that. What if they said no? Well, if they said no, the reality is they're probably in that pre-contemplation, contemplation phase where forcing the conversation forward is going to harm your relationship. And so rather, it's better to plant the seed today to get them thinking about it than to push forward. Yet, when you ask someone, would you be open to discussing that? Sort of a generally accepted rule is if someone asks you permission, more likely you say, yeah, that would be fine. And when someone says, yeah, that would be fine, they're going to be more open to having that conversation. It also is a great way of demonstrating respect towards our client. So after we've transitioned, we want to then educate our client around why making changes will benefit their animal. And so research looking at compliance in veterinary medicine has identified that client uncertainty and lack of perceived value far outweigh most clients' concerns about cost. I know from our research and even observing veterinarians at times that there's a nervousness to talking about nutrition, talking about things related to nutrition, that practitioners are concerned that they're going to come across as being perceived as a salesperson. Yet, clients lack uncertainty and perceived value a lot of the times in terms of why they don't follow through with the recommendation. And what they found in this study, it was how well we as veterinary professionals explain the reason for our recommendation that really influenced their perception of value and quality of care. And in addition to observational research, we've done a fair bit of qualitative research, including focus groups with pet owners and veterinarians. And when we looked at the way that pet owners talked about value and the way that veterinarians talked about value, we saw there was a difference in perspective. When talking about the value of the things we offer in veterinary care, pet owners always talked about wanting to understand it in the context of the health and well-being of their animal. Whereas in the veterinarian focus groups, oftentimes veterinarians would highlight the importance of making sure clients understood the value in relation to the time, the service, the products that they could offer. And so this disconnect that potentially exists there can challenge how we educate clients in a way that is relevant to client or relevant to that individual client. And so in this more recent work, this is another paper that just came out a couple of weeks ago, we did basically an update study looking at cost conversations and the communication of value in veterinary medicine. I have the results for the more recent one, but it hasn't changed much in the last 10 to 12 years. And what we found was when veterinarians do talk about cost and look at how they convey the value associated with the cost for those veterinary services, 8% of the time, they're just general cost conversations. So you're going to save yourself about $20 today. 74% of the time, they focus on the time and the service offered. Mrs. Smith, I recommend we do some blood work. It'll be $150, end of story. 42% of the time, the conversations offered some medical information in terms of what would be gained as a result of doing that. So Mrs. Smith, I recommend we do some blood work. It'll be about $150. What it'll allow us to do is evaluate Rory's kidney and liver enzymes. And the opportunity that exists is that only 14% of the time did those conversations go that next step to really convey how any of that would benefit the health and well-being of the animal. So Mrs. Smith, I recommend we do some blood work. It's going to cost around $150. What it'll allow us to do is evaluate Rory's kidney enzymes, and if they're elevated outside of the normal range, we'll likely have a conversation about changing his food to reduce the stress on his kidneys and allow him to live out a healthier and happier life. And so what we recognize is as a profession, we're really good at highlighting the features, the time, the products, the services that we can offer to a client. We're not too bad at highlighting the function in terms of what medical information will that give it, how does it work, yet there's an opportunity, as I mentioned before, to really focus on the benefit. How is it going to impact the health and well-being of the animal? So when we think about a therapeutic weight loss diet that we offer to a client, are we offering a client a feature, a function, or a benefit when we offer them a weight loss or a therapeutic weight loss diet? So I'll ask you to indicate your thoughts on this, whether a therapeutic weight loss diet is a benefit, a feature, or a function. So just give it a little bit more time for the horse race to settle out, because we can see it's kind of jockeying. And so we see the majority of people that have joined us have identified a therapeutic weight loss diet as a benefit. Yet at the end of the day, it's really a feature. It's a product that we offer our clients. And yet as veterinary professionals, our mind immediately sees the inherent benefit. Yet for pet owners, they don't have that knowledge and don't see the inherent benefit, and therefore we need to have the conversation to help them understand how it's going to benefit their animal. And so we really want to, when educating, focus on the benefit. Something like, by changing Max's diet to one that will reduce his calorie intake while also meeting all of his nutritional needs, all I've focused on to this point is the feature and the function. The diet, it'll reduce calories and meet his nutritional needs. We need to follow that up with the benefit, which is it will help us work towards safely reducing his weight, which will help him live longer, be less likely to develop arthritis early, and to live an overall better quality of life. So going back to the study where we looked at 463 interactions that had any mention of weight, 150 had specific interactions either with a veterinarian or technician around the topic of obesity. What we identified was only 28% of those interactions made any communication to the client about how weight management would benefit their pet. And so again, we see an opportunity that exists there. Once we've educated, we need to think about, well, what are the options to this client? What are the options we can present this client in addressing the recommendation that we want to make? So we've, again, done a fair bit of focus work. We've done some in the past. We've done some more recently. This whole topic of options comes up every time, and I would say it's stronger today in terms of pet owners' expectations than it ever has been before. And what we've heard is that pet owners want to be involved in the decision-making process, and they want to know what their options are. The American Animal Hospital Association did a study where they identified 90% of pet owners want to know all of their options, regardless of whether or not we feel that they can afford them. What we heard in our focus group work was they want to know their options, but they also want to know in the context of their individual animal, its age, the pros and cons, as well as the cost. And that can be hard, to communicate options in a way that a client truly understands the difference between the options. And yet, it also comes back to this thing that I referenced earlier, some of the inherent conflict that exists within veterinary medicine, in that we provide healthcare, but we're also a business. And so if we're not communicating to clients in a certain way, they wonder what's driving our recommendation. And so as this pet owner in one of the focus groups said, if they give you different options and it's not like they're just trying to make a sale or push one drug or another, I like that. So by presenting options, it gives them some autonomy or involvement in that decision-making process. So once we presented options, this is where our recommendation comes in. So there's a lot of work that happens before we get to making that recommendation. And going back to that work where we heard pet owners say, we want to be presented with options, they were also looking for our medical advice as veterinary professionals, and I think it's captured in this quote. To have a straight-up conversation about the range of options, the professional advice from the vet's view, the preferred option to the circumstance, I think that's part of the service, and I still get to exercise choice. In our work that I referenced earlier around adherence to dental and surgical recommendations, what we found was when a veterinarian gave a clear recommendation, clients were 7 times more likely to follow through with it. So recommendations are important, but they need to be placed at an appropriate time in our communication with a client. So looking at those 150 obesity-related interactions, what we found was 43% of those conversations included a clear recommendation or guidance around weight management. The challenge with this is that we know that there wasn't a lot of history necessarily gathered in advance of that recommendation. So again, there could be a lot of shot-put recommendations rather than relationship-centered recommendations, which can lead to very different outcomes. And then finally, we want to check in after we've made that recommendation to see how it's landed with our client. So it might sound something like, what are your thoughts on developing a weight loss program for Max that includes changing him to a calorie-reduced diet, treat monitoring, an exercise plan, and bi-weekly weigh-ins? What this provides is an opportunity for the client to say, well, you know, we're maxed out in terms of dog walks and getting him out. I'm not sure we can do that. I appreciate you sharing that with me. Let's start with the other elements of the plan, see how we can do, and we'll continue to have conversations to make sure that we do what is best for you and your family and ultimately max health. So going back to the work that we just published looking at pet owners' stages of change, we asked two other questions. We asked a few other questions, but two other key questions in relation to their stages of change. One was their interest in addressing their pet's weight. And not surprisingly, it aligned very well with where I would expect it in relation to the stages of change. 6.9 out of 10 for those in the pre-contemplation was the average. 8.6, so a little higher for those that have acknowledged that there is a problem, but have all the reasons why it's hard for them to do anything about it. 10 out of 10 for those that were in preparation, action, and maintenance. We found statistically significant differences between those, and so it just sort of validates some of the stages of change and where people fell. What was interesting, though, was when we assessed their confidence, we actually saw no difference across the stages of change. And I share that to highlight that confidence and supporting a client in how they can continue forward in a weight management plan becomes critically important. And this is maybe where we would use something to check in with a client, such as a confidence ruler, where we say, so on a scale of 0 to 10, how confident are you feeling in being able to follow through with the plan we've discussed today? Client comes back and says, I really want to do it, but about a 7. Appreciate you sharing that with me. What would it take you to get to an 8 or a 9? And allows them to share what they may need from you or the practice or what things they might need that you can brainstorm or troubleshoot with them to get their confidence up. And that is regardless of where they fall in their stages of change. So just to end things off, let's go through a case scenario with Harley, who's a 4-year-old male-neutered Bernese mountain dog who has come into a clinic. So let's say you're in veterinary practice. He's weighed in at 49.5 kilograms and been body condition scored a 6 out of 9. And you've been trending his weight and seen it's been creeping up over the last few years, probably since like early puppyhood. And all of a sudden, something has happened. So our first step to creating a weight management recommendation for Harley is gathering that comprehensive history. So we start to explore using those open-ended questions. So walk me through a typical day for Harley. What we learn is they feel, as owners, that he's in good general health. He has moderate activity. He's motivated by food and described as a counter surfer. And he's had a dental cleaning last year. So they're staying up on his health care. We then transition and explore some things in the environment, and what we learn there is that there are no other animals in the household that we need to be concerned with, yet they do have 3 children under the age of 12. So for me, that kind of goes off as maybe a little red flag to keep in the back of my mind. He visits a fenced-in off-leash park once per day and has unlimited backyard access. And they share that grandma moved in 6 months ago because she needed some additional care, which has added a lot of extra stress to their family as well as some financial obligations. So that's another thing that goes off in my mind. Then we start to appreciate or explore some of the human aspects of the history. We learn that they've chosen to feed a giant breed adult maintenance kibble because they want to tailor the food to what would be appropriate for Harley. Training is important to them because they have young kids and they need a well-behaved dog given Harley's size, and so lots of treats around training. They try and minimize, but Harley gets food scraps for the kids because it's just the nature of having 3 young kids under the age of 12. And since Grandma's moved in, Harley and Grandma have created a great bond over food. And so Grandma's giving a lot of food to Harley in relation, which supports the strong family attachment. And we know because Grandma's moved in and some additional costs, there is some cost consciousness among these clients. Otherwise, on the physical exam, there are no other concerns other than the body condition score of 6 out of 9. So this is where we now transition. And if we use a graph that contains these transitions, it helps support having that conversation. If I was a client and someone came in, I'd like to show you Harley's weight over the last 4 years. I would be looking at it with no other words and thinking, whew, something's happened. Then the veterinarian says, I'd like to spend some time discussing Harley's weight. Would you be open to that? I'd probably be more likely to say, yeah, we got to explore what has happened in this context. After we've transitioned, we then want to educate the client on how addressing Harley's weight at this point in time will benefit his health and well-being. And that's one of the great things about pet obesity, pet weight, is there's some good longitudinal data that we can use to help support these conversations on the benefits to the health and well-being of the animal. Research suggests that animals will be able to live longer, delay of onset of osteoarthritis and chronic disease if we can maintain them at an ideal body condition score. And this really comes back to emphasizing we can improve his long-term quality of life, which is important to many owners. Once we've educated, now we need to start thinking about, well, what are the options available to the owner? And around weight management, there are options. Sometimes we think there aren't options, yet there are. We could do nothing. We could increase exercise alone. We could reduce his current food, which we see a recommendation not uncommon in veterinary practice. Or we could develop a formal weight management plan with the client that includes a therapeutic weight loss diet. It includes measuring with a gram scale, so we're giving accurate amounts of food or calories to Harley, developing an exercise plan, talking about adjusting the volume, but maybe even breaking up the treats and what the treats are so that we're getting less calories through that relationship with grandma. And then bi-weekly weigh-ins so we can track success in terms of if we're moving too fast, we can slow it down. If we're not moving fast enough, we can make some other adjustments. So after we present the options, though, we then need to educate the clients or inform the clients about how each of these options contribute to the health and well-being for Harley. And so as you can appreciate, some of these are gonna help Harley achieve ideal weight more so than others. So we probably all appreciate that doing nothing is probably gonna continue on Harley's current trajectory with increasing his weight. Increasing exercise, we all can appreciate it takes a lot of exercise to burn a certain amount of calories, so whether we can be successful in achieving ideal weight is a question mark. Reducing current food to take them into a negative energy balance could get down to an ideal weight, or most likely where we've got weight, measured food, exercise plan, monitoring of treats, has the greatest success of getting down to that ideal body condition. We know some of these do a better job of meeting nutritional requirements. And so again, doing nothing, assuming he's getting his nutritional requirements and probably exceeding them with the current consumption of food. Increasing exercise, again, we're not changing his current food, so assuming he's getting his nutritional requirements through his current food, that could be possible. Reducing his current food, we know that that runs the risk that if we cut back too much, we're gonna put him in a place where he's not gonna meet his nutritional requirements, and a formal weight management plan allows us to get there. In terms of delay of onset of osteoarthritis, if we continue on our current trajectory, probably, we know through the research, there's a good chance he's gonna develop osteoarthritis and probably earlier than he would have otherwise. Increasing exercise, he's a large dog, that added weight is probably gonna put extra stress, so again, has a risk of osteoarthritis. If his reduced current food could put him in that negative energy balance and get him down to an ideal body condition score, it might be a benefit in delaying the onset of osteoarthritis, yet the formal weight management plan, particularly if we pick a therapeutic weight loss food that has a mobility component, probably has the best chance there. And then improve quality of life. Doing nothing long-term is gonna probably compromise Harley's quality of life. Increasing exercise, he might get some stimulation, yet if it has some negative impacts in terms of earlier arthritis, those kind of things, it could impact on quality of life. Reducing his current food, again, if it gets him down to an ideal condition, that could be good, yet if we're dealing with nutritional deficiencies, that could be bad. So again, pluses and minuses, yet a formal weight management plan probably hits the target best. So now that we've kind of illustrated the differences in value to the health and well-being of Harley of each of these different options, this is when we bring in the cost. Because if we bring in the cost earlier, people are just gonna fixate on the cost and not consider the difference in value between each of these options. And now if we're making a recommendation for a formal weight management plan, the client's looking at it and understanding that the reason we're making that recommendation is because it brings the greatest value for Harley rather than it's the greatest cost. Yet if we only present cost, it seems like we're presenting the thing that costs the most. Then we check in with the client. And when we check in with the client, they do stress that costs have been a challenge because of grandma's moving into the household. And so we say, you know what, let's work together. We can remove the mobility from the therapeutic weight loss diet. It'll bring the cost down a little bit. The other thing is thinking about how we present cost to clients, particularly around nutrition. It's gonna end up being an $11.40 more per week or $1.60 more per day. And I can imagine for some clients, they'd be looking at that and thinking, that's less than a coffee a day. I can probably give up a coffee a day to benefit Harley's overall health and well-being. So I feel like there is an opportunity here for us to, again, look at obesity, which we know hasn't changed in terms of the prevalence, and if anything, is probably going still on an upward trajectory, and supporting some of the efforts we've been making in veterinary medicine by looking more closely at this gap that exists around communication. Because we've highlighted that there's an opportunity to enhance our nutrition histories. We've highlighted that there's an opportunity to, again, have conversations that highlight the benefits of making changes for owners, and a clear recommendation. Yet that clear recommendation has to be placed in the right spot and not led with, because I think that can push people off the idea. And so from my standpoint, we have amazing information and knowledge around obesity and how we can address it. There's an opportunity to strengthen the bridge to get that information into the hands of the client and benefit our patients. Thank you for your attention. I'll hold questions till the panel at the end. If you're interested in the full references or other things that our team is working on, I put some links up there. Thank you.